Hello, good morning. I'm just going to take you through this dashboard. So I'm going to go to my website, www.themassagenegotiator.com. And this right here is for SEO. That's what they do. But we're going to go to the Health Body Region Info tab. And then explore your body with this database. Explore me with me as I add chiropractic foundational health to this database. This page is to help you navigate your body as I update this work in progress. I'm still updating it actually. There's quite a bit of stuff I need to add. But I've taken it into many different files. There's a couple dashboards that actually help you to understand. And I have a video right here that you can watch as well. This phone number you can call, or you can call this one. That's the old one. This is a new one. They both work, but I'm just trying to move away from this one because I've had it for so long. And I would know that, like, I don't know. Anybody who calls it, it's probably calling for anything. So to say hi from family or random friends or old clients. So that's why I have the other one too. So the diagnostic health tools by body region for personal healthcare insights. This is the key, the body region key. This is the diagnostic process, which is basically their whole workup is that you go by this body region, you have a chief complaint, you look at the symptoms, which could be from radiologic symptoms, depending on the course. If we go through each one of these, the pathology, what are its signs and symptoms? Abdominal aortic aneurysm. And then you got radiographic findings. And then you got how it starts, what it looks like, or what describes it, which is the etiology, or the demographics as well. And then this is the diagnostics by ultrasound because it's less invasive. Definitive diagnosis is with radiograph to diagnose it. Management treatment, they might not be in this one. Alternate pharmaceuticals, those could be what are prescribed by other healthcare professionals if you happen to know it. Method of action for the pharmaceutical, side effects for the pharmaceutical. So most of these are going to be null. If you want pharmacology, you could just go down to this lower one. But you're not going to see everything here because you have to actually click on it here. And then you go to the main dashboard. And this one's for looking at the to make your diagnosis assessment. So we went over that method of action. That's for the drug. So these three right here, those are if you know the pharmaceutical for that diagnosis. You just go down the row and see reference course. You can look there. That's image interpretation. If you look at anything image interpretation or any like advanced imaging or something like that, it's usually not going to be fully filled out. And it's going to be diagnostic with descriptors for the radiography. Sometimes it'll have the clinical symptoms too. And then it has the text course references that these notes were synthesized from. And let's just go through it. And the theories, that has more information. It's just not in the pathology, signs, symptoms, etiology format. So this one is, takes it apart and puts it in a format you can look at. And then you have the theories little chart. It has the body region, which you would use this key for. So let's just go to appendix. And then you would see IPES has a lot, which is intro to physical examination, skills. And then so you'll see that for that, these are visceral pain, Rosong sign, hollow organ, contracts too forcefully, becomes over distended or stretched. That's describing appendicitis because we use that as the key, and everything else is not mentioned unless it's coding and billing. You go to bladder and see what's there. Bladder, unstable bladder. They might be on tolterodine, or generic is Detrol A. And then the evaluation and management, E&M is evaluation and management code. That's the initial visit. Nothing for co-manage with the, we would have, instead of the 0 right here, would have a 1 right there. And those are timed managements. It describes what it is right here next to it. We can go to autoimmunity and see as well what's in there. And this is free. You might be able to download it. I'm not sure if I enable that. Oh, okay, so you can download it. PowerPoint, PDF, image. Interesting. Okay, but that was for one dashboard. Let's go down and you'll see more. There's also procedures one. There's emergency treatment. That's going to be in CPR. What is CPR? Emergency first aid. And it describes a lengthy description of when to use CPR and what types of emergencies. Gallbladder, you can go to that. Alright, it's going to have a diagnostic, abdominal pain. What's a pathology? Cholelithiasis, that's like a stone in your gallbladder with inflammation. Symptoms are severe right upper quadrant pain, and it'll list a whole bunch of other stuff. You can go to the foot. By body region, this is the key. And this is where this key is. You just connect all of these tables with it. There's nothing in vitamins, minerals, and pharmacology for it specifically. But pharmacology might have something for like pain if they needed it. Or endocrine if it was like acromegaly. Procedures, these are procedures descriptors. It's not completely filled out, but it'll show you. If it is a procedure, it's either an assessment, a mobilization, a palpation for restrictions, or a chiropractic procedure, which is telling you how to adjust, which is how is the patient positioned, how is the doctor positioned, what is the segmental contact point with the contact hand. Contact hand is segmental contact point for the support hand. The support hand is tissue slack, which direction on top of the line of drive, and then the reference course, and then the course textbooks that they were sensitized from. Some of them were just an instructor. And then we're gonna go to some other specific physiotherapy modalities. Not all of these are specific body regions, but they could be a different topic. If you want that, just explore it. I mean, nothing's gonna happen. So it's just gonna show you some information. Let's explain this. Okay, physiotherapy modalities, alternating current, Faraday wave current, or square wave current. It tells you what it's used for, a lengthy description, contraindications, indications, how to use it. It's from this course, and that's the course textbook. If you want to go to this one, this is a CP3, but it's a soft tissue physiotherapy that you can use. It's a mobilization type, not really a specific mobilization, but it is something to help with stretch and strengthening of muscles. It's called post-isometric relaxation inhibition, or yeah, I think that's what that second word, or crack is what they call it on boards, which is contraction, relaxation, antagonist contraction, because that's basically what it is. You have to contract one side, and then you have to give them time to wear out that muscle that's on the opposite side to inhibit its pull on the opposite muscle that you're trying to stretch, so that you can get more stretch. Because the reason it's not stretchy so much is it's inhibited by the spindle, the muscle spindles, which is a reflexive action, and it's musculoskeletal reflex at the cord, and it doesn't go up to the brain. So it's instantaneous. Special testing, that can be EEG, electronic encephalopathy, graphy, or it could be EKG, it could be clinical lab diagnosis, special testing for agglutination testing, anti-double-stranded DNA, and it'll tell you what it's for, what's it gonna show, since for RA, that's used for RA. You might also see it in here if you see it, a pathology. The arrows aren't listed, but you can just go to the bottom and let me see. It might be listed as rheumatoid. No, it's not listed right there. Okay, but it has chief complaints. Just special testing that you could go through as well. I mean, I find this useful. You might find it useful if you spend enough time with it. I haven't been adding more stuff to it. I do have other stuff I want to add. So this was like most of the stuff though. I'll tell you right now, I can show you what all I have been doing. Reproductive system. Interestingly enough, I don't really have anything for this, so I can delete it. What you're gonna see is you need to go to female or male reproductive system to see about that. I have some stuff from general anatomy as well to take you through. And then it'll have like adenocarcinoma, hypopituitary, androgens, cryptorchidism, epispadias, all sorts of stuff you probably will never really need, but it could possibly point to something else if you find somebody who complains of certain stuff. When I first began this and we were doing this in general, I was like, why are we learning this? You know, but it actually is relevant because the genital urinary system is useful for pointing out pelvic pain or symptoms that just don't relate to anything else, and it could be associated, like if you were to look at the female reproductive system and then you go to ectopic pregnancy, you'll probably see something there that explains what the signs symptoms are. Okay, it would be over here if it's listed. I should have it listed. Fibrocystic ectopic pregnancy. Here we go. Class, and the chief complaint is missed menses, irregular vaginal bleeding, lower unilateral abdomen, and pelvic pain. That could be anything, right? But if it's an ectopic pregnancy, someone can die from that. Not just the baby, but the mom too. And it's usually related to chlamydia. If you go to etiology, and it says that chlamydia is in there right here, and gonorrhea. But it'll explain more information if you happen to see that. But the chief complaint's nice because if you have somebody who complains about these things, if it's listed, because really that was taken from one course, differential diagnosis 2 of the visceral system, which I also thought was kind of retarded that a chiropractor's teaching it instead of a medical doctor, like what we had for clinical lab diagnosis was a medical doctor, because in the field they're rarely going to even encounter those conditions. So they have to just go by the textbook, which is 20 years old. They're not going to do any new research on it, but they can refer them out and know that conservative treatment isn't going to work. I mean, I was upset with that, that it was taught by a chiropractor and that's not even practicing anymore. He just instructs and not a medical doctor, because then it would sound more realistic. But it's from a chiropractor who wrote their textbook. If we can go to abdomen, because I'm sure it's in there for a lot. Or yeah, we'll just go to abdomen, and then I'm gonna show you when you go through the reference course, you're not really gonna see much for imaging. It's just if you're interested in what it looks like on the X-ray. Let's say you have X-ray, or if you go to advanced imaging, you might have some DDX2. Here we go. Let's keep all those, and then we'll just go to anything. Let's see if it keeps it. It does. So these are differential diagnosis too. And you can see it'll just show you like what the chief complaints are: abdominal pain, lab conditions, that's just general. And then under that chief complaint, there might be multiple pathologies that it could be, but then it'll fine tune it to the symptoms if it's listed, etiology, diagnostic. These are all general right here because if it's general, I just put it somewhere, and that was like a placeholder. Thyroid condition, chief complaint, that's going to be general right there, but this is a pathology, and that will have the sign symptoms. So all of these are theory basically because there's only a 2% chance in office they actually see this, but they would co-manage with more people that were already diagnosed with it. And it's good to know this stuff in that rare 2% of chances that they see all this. But if they have older patients, they're going to see more of these people. So it's not really going to be 2%. But most of these people that come into their office are soft tissue skeletal complaints. If they're younger, it could be more serious pathologies or just pathologies that need medical intervention, which they refer and they get prescribed drugs or some other treatment plan for like wellness, which wellness is in every health field. You want to get, let's go to nutrition. I want to add a lot more to nutrition. So I did add that here. Let's just go through these keys right here for the body. You're going to see, why is breast listed in chiropractic? Well, you know what? There's some diseases and pathologies in the breast, brain, same. All right, let's go to, why is biochemistry? Because, you know, respiratory alkalosis, metabolic alkalosis, or acidosis, those are related to biochemistry. Autoimmunity, good to know if something's going to work or how to handle an autoimmune disease. Advanced imaging, you can see advanced imaging. I made this because that's stuff outside of radiography, x-ray imaging. So hold on, here we go. Advanced imaging, I've only got it listed for the theories, so I didn't do that. With them, it should be listed though. There should be way more features listed in the diagnostic process. I'll have to look into that. Okay, so we got appendix arm, autoimmunity. Let's look at autoimmunity. And then we have, you can see it's filled out, but there's nothing in procedures, nothing in radiology that I've listed because this is radiology positioning. If you go to this other one, I have something on radiology, but it's going to be more for bone tumors, which you can see would be a serious condition. You'd have to know, hey, how serious? Is it benign? And some of them actually go on their own. Or is it malignant, which means it can spread to metastasis and kill someone. And you would just open this up also in a separate window. So yeah, I do want to add a few more files, but I have to manually go in there because they're my notes. And then I found it helpful to use. Especially when you're making your notes, you can ponder on someone you've seen as a massage therapist. There's a lot of overlap with chiropractic in how you evaluate and palpate, get the tenderness to palpation, see their range of motion, what side's restricted compared to the other side, comparing bilaterally, what their constitutional signs are, if they have a fever, sweating, redness, or vomiting, you know, nausea, diarrhea, all that stuff, headaches, or they have red flags for treatment conservatively and they should need to be referred out. It could be an emergency condition like they're choking, heart attack signs, or stroke, or, you know, they have a history of cancer and they're older than 50, could be metastasis. They're sweating at night. They don't normally sweat at night. It's not hot. They have pain that won't go away. Pain is worse at night because they're not doing anything to take their mind off of it, and there is nothing that relieves it. No body positioning, no medication. They also lost weight, you know, about 10 to 20 pounds or 5% at least of their body weight without doing any changes to their diet or exercise. And they cannot have their pain reproduced. So that's a really big, those are big red flags for emergency conditions. And when you refer, it's important that you sound like a doctor, and that is really important because chiropractors just don't get enough respect. So when you refer, first off, don't just refer to anyone. If you can't treat it, say you need to go to your primary care physician or your urgency department or your emergency department, and get treatment for this because we believe you have something that's more serious and you need it for. If you know specifically just based on their symptoms and you can get like a radiography of it that proves it, or it can be something that can diagnose it. If you go up here for a definitive diagnosis with like a special testing, you don't have that as a chiropractor. You're not going to have access to special testing. You're not going to have access to labs right away because you're not in a big facility most of the times working with those medicines that medical doctors use. But you can refer out to get more testing and see if their insurance covers it, or if they're a cash paying patient, or their union covers it, their union insurance, group insurance. Yeah, so you want to make specific recommendations because of a diagnosis, which you can have multiple, usually will because it won't all be definitively something suspected, especially if you don't normally see these people. Like, you know what I mean? Yeah, so I was thinking that was really helpful. I want to share this with everybody. Yeah, because you can actually get the textbooks and write your own notes, and these are synthesized notes for my 3 years in chiropractic medical school. And then I got kicked out because I was recording and posting procedure videos, and then Shelby Google decided she wanted to make it look worse than it was, all because somebody else said that, oh, it is worse than it is, when it's not just what it is, you know? So, there you go. Anyhow, it's a waste of fucking time if you're going to do this. Just do massage instead. And then you can use all this information and get your books, because you still have to have a pharmacology textbook to know what you're working with if it's something else. And you make the same referrals. The only thing is you don't have the x-ray imaging. And actually it's very, very precise, and you can get in trouble and lose your license. If you make the wrong diagnosis or you miss something in the film that was something you were taught. So most people don't even diagnose the radiograph unless it's something obvious that they know for sure there's there. But I'm not going to tell you anything else until you get that looked at. And it's expensive. Radiographic machines, x-ray machines are like $30,000. Interestingly enough, they're made with tungsten metal, which they make in rings. So if you hated someone, you could shatter that tungsten and put something on it, like a really hot, high voltage, like 220 volt electric cord on it, on like a metal sheet, and then all sorts of x-ray ionized radiation would leak out. As long as you can make it 3,000 degrees in temperature. Isn't that crazy? Oh my gosh. But don't do it. I'm just saying. Yeah.